Yes, I think this is an era of patient-centric because patient now wants to know what is happening to him, what is his medical plan, what is going to be the future. They are asking so many questions and justifiably right, because it's very important to know what are we going to do with the patient. That's something which was a gap, because it's not like emergency is okay, patient comes in emergency, we handle that. But most of the time it was earlier. If it's been like, okay, patient goes to a doctor prescribes something and he says just take it, nothing much. Now they are well read, they're well aware. The technologies make them enable, they question before coming to the doctor, they read coming to the doctor, and then they, whatever you say, they want to read and come back to you again. So it's important that whatever decisions we make in the healthcare, it has to be transparency. So patient-centric is one thing, the process of transparency in the treatment, asking the patient, because there are multiple type of treatments and diagnostics or whatever is available. We have to ask, what do you want? And accordingly, because unless you thirst something with the patient, he will never be able to accept it. Maybe unwillingly he have to. But I think that's what the gap was till now, was like some couple of, because technology was not there. The doctor had never had time. He just had, okay, medicine and then you go. But now, technology is a supportive tool. You can make patient aware, let him talk, whether it's a chatbot, or whatever material information, everything is available on that at a click. So that is patient-centric care is going to be here, because without that, I think no patient treatment is complete. Complete healing only happens when patient is satisfied. It's not like patient symptoms are gone. Satisfaction only comes when the patient knows whatever has been done to him is done as per what he wanted and he's happy. That's what it is. Oh yes, I think telemedicine, teleradiology, telepathology, I think this is something which is like now a norm. Everybody, nobody knew about till 7 years back. Teleradiology we were hearing, okay, but telemedicine, nobody thought about it. All this has been happening since about 70, 80 years, erratically on phone, but structured way it has come up now. So this telemedicine, telepathology, digital pathology, digitalization, and I think it's definitely the era, because this is something without you cannot survive today. Because how do you make your healthcare accessible to remote areas? If you look at the numbers, we have, say, one doctor for about 1500 population. As per the World Health, it's 1 per 1000, with still so much of gap. 30% of the population still have the underserved area. We cannot reach. Logistically, you can't reach. Maybe there, because this sparsely populated area. AI helps all that, fills the gap. AI, technology, digitalization, all this actually fills the gap. Because you can use it, may not as a replacement, but as a supplement to what exactly what you're doing. That's what I think the technology is doing, the AI is doing, digitalization is happening. Because triage can happen. In the bigger hospital, tertiary hospital, even basic diabetes patient comes to a bigger hospital. The doctor is already loaded. Why they should come there? I think the basic triage screening can happen at that level, and only those required have to come to the next level. But most important, once you to do that, what you require is your AI system, your technology has to be fully validated, trustworthy, and how have they arrived at the algorithm and the answers? That has to be open. I think in and we are heading for that. I think the way we forward, I think only way forward in India is to adopt this, make it healthcare affordable, accessible, and quality driven is going to be AI. But challenges are there, but I think we can all overcome. We will be able to provide success, build together, integrate together, collaborate together, and adopt these new technologies in a way that it supplements our productivity and probably help the healthcare. My experience here has been wonderful, because I think every time I try and come here, because I think these are sort of diverse topics and which is very current topic. And then lastly, the integrated topics, because various people talked about various aspects. So it's very, very informative, very, very insightful. And every time we pick up something new. This time we talked about patient centricity, how patient centricity in diagnostic, it happens in the clinical forum, it happens with the preventive health. I think putting that together, that's what the Elets is. I think great experience, and I wish you all the best.